Hi everybody, I'm Matthew Hammond. I'm the Trustwide Matron for Safer Staffing, and just very briefly, I'm here to talk to you guys today about safer staffing and to update you on some of the things that we've been doing in the trust around safer staffing. So, really, very briefly, what is safe staffing? Well, in essence, safe staffing is about us having the right staff with the right skills being deployed at the right place in the right time. This is a really kind of brief overview, but it's a really good kind of definition around what safe staffing is and what it should look like. There's quite a lot to it, but ultimately it falls under Regulation 18 from the CQC, which is part of the Health and Social Care Act, which essentially says that we should have enough suitably qualified staff, competent and experienced, to be able to meet all the other regulatory requirements under the Health and Social Care Act. So it's a bit of a catch-all, but essentially it embodies that we need to have the right staff with the right skills, the right place and time. But what does that actually look like? Because that's all well and good. It's very much a definition and a theoretical. But what does that actually look like in practice? Well, it depends really, and it kind of depends where you sit. And I don't mean that as in a chair like in the picture, but whereabouts you sit within the trust, because what safe staffing looks like for the nurse in charge of a ward somewhere can be very different to what safe staffing looks like for the director of nursing, for example. But ultimately, it has the same kind of core principles, which is around the delivery of safe, effective, caring, and well-led services on a sustainable basis. That's kind of the core elements to what safe staffing really is. What does it look like locally then? So locally, and when I say locally, I mean probably at a ward level. What safe staffing looks like is that you've got an establishment set which is safe and effective. You're able to care for your patients, and you're able to meet all your kind of patients' needs. That the system around you and your ward and your patient needs has some flexibility, and that the system is able to respond to kind of changes in workload, whether that be in increased patient acuity, unexpected demands on the service, such as needing to take a patient to hospital, whatever. That the system has some flexibility to be able to respond to that. That there's effective escalation processes there in place which work, which is where if you feel that the staffing's not right and it's unsafe, that there's somewhere to go, there's an escalation process which listens to you, and is able to take some action to be able to mitigate the risk or solve some of the staffing dilemmas which you might be facing. And finally, that locally, that there's an ongoing kind of monitoring and improving around staffing and how we're able to care for our patients. Organisationally then, how does it look? And I use this picture of a table and chairs, and I'll probably get told off for this, but this is always what I imagine whenever anybody says the board or the board of directors. I imagine this table and chair. So this is the picture that I like to use. Essentially, organisationally, we need to make sure that there's really effective governance structures in place to be able to have a real good understanding about staffing deployment, patient safety, quality of care, for us to be able to take action, and be able to just be assured that things are okay or not okay, and if they're not okay, so we can take some action to try and solve some of those issues. Organisationally, we are required to make sure that every area has an establishment review. Historically, this always used to be inpatient services. More recently, there's a bit more of a push around community services as well. But we need to make sure that establishment reviews are occurring at least every 6 months, to make sure that planned staffing that we're putting in is safe, effective, sustainable, all those kind of core principles that I mentioned before. That we're using evidence-based staffing. For inpatient services, this involves the use of evidence-based staffing tools, such as the mental health optimal staffing tool or the safer nursing care tool. They give us kind of that objective evidence base around staffing. That there's very similarly to the locally, that there's effective escalation processes which work. And again, that goes back to the really good governance structures. And finally, exactly the same as locally, that we're continuing as an organisation to monitor and improve kind of our staffing across. So that's a real kind of brief overview around what safe staffing looks like. What I'll move on to then is what's new. Because as a trust, we've done loads over the past 12 months around safe staffing and development of different things to try and support safe staffing. One of them has been the development of a trust-wide safer staffing group. This group meets monthly and reviews kind of staffing across the trust, identifying areas which are particularly busy, particularly stretched in terms of staffing, where staffing's not quite right, or the staffing's been really above or below kind of what we'd expect it to be. And that all kind of gets pulled into a monthly safer staffing report, which gets reviewed. We then look at things like the safer staffing dashboard, which has been developed to try and support that process, and that looks at the staffing, so how staffing been, compares the staffing to patient safety indicators, how safe services have been, how many serious incidents wards have had, what sort of incidents have had, what kind of themes and trends are developing, quality of care, care process stuff, so how well we've filled bank and agency shifts, these sorts of things, and then kind of workforce indicators, you know, sickness levels, bank and agency use, these sorts of things, vacancies. And it pulls them all together in one place to give us a really good kind of overview around what safe staffing is. One of the other things that we've done over the past 12 months is we've reviewed kind of the process around our establishment reviews for the inpatient services, in particularly for mental health, local mental health services and the forensic services. And as I mentioned earlier, we've started using these evidence-based staffing tools, and just about every area in the trust now has undergone a establishment review using these tools. And if they've not, they're due to undergo them in the next month. That the establishment reviews have moved away from being purely based on the nursing establishment, but to focus on the whole MDT, acknowledging that all members of the MDT have a role in keeping patients safe and the delivery of safe and effective care. And the format's very much been focused on this: right staff, right skills, right place and time. So we've got the right numbers of staff planned in, have those staff that we've got planned in got the right skills and experience to be able to meet the patient needs? And are we making the best use of that resource that we can? Are we deploying them at the right place and the right time? Then finally, triangulating all this information along with professional judgment to be able to say, yes, we've got safe staff in there. No, we need to do something about it. And here's the actions that we're going to take. Also, we've been piloting establishment reviews for community teams because they don't have kind of a national standard attached to them in terms of using evidence-based staffing tools. We've had to develop a bit of an internal process for how we're monitoring and reviewing the establishments. We've started piloting that in the local mental health teams in adult mental health, and the plan's going to be to roll that out further when we've got a bit more when we've been able to spend a bit more time getting that methodology right. One of the other things I really think has been really important is we've developed something called red flag staffing events. And these are essentially clearly defined events which, if they occur, that essentially patients potentially are going to be put at risk. So we've clearly defined these events, and these are things like preceptorship nurses working as lone qualified, for example, on a ward as the nurse in charge, clearly has an increased risk to the patient group. So we need to do something about it. So we've clearly defined these events, and we've come up with a really clear, robust escalation process, which should be able to resolve the events when they occur or have the potential for occurring. And finally, it's just going through the final stages of approval within the trust-wide approval group, but we've developed, this has been included in the trust-wide safer staffing policy. Safe Care. So for those of you who don't know Safe Care, this is a system which works alongside the e-roster system, and we're doing a big review project starting with IDD and CAM service to review the functionality of Safe Care. Why are we using it? What do we use it for? Embed kind of the current deployment methodology. So rather than trying to reinvent the wheel, we're going to use how staffing is already being deployed. In most areas, that tends to be observation driven. So enhanced observations, intermittent observations, these sorts of things. And then what we're looking at doing is embedding that process and system within the existing systems, things like the daily demand meetings. And then very finally, because I know I'm running very short on time, we've developed a Connect page, which has got all of these resources within them. So it's got all the reports that get produced around safe staffing, a copy of all the different dashboards for the services, the wards, everything's kind of within there. All the guidance around safe staffing, red flag staffing events, the evidence-based staffing tools are kind of all within this one place now. I've also started to develop some videos around safe staffing, what it looks like, how to use some of the tools, the sort of things that you can do to try and understand your safe staffing a bit better. And finally, it's been updated regularly. So I'm updating that with anything new that comes out. So it's kind of a one-stop page for all things safe staffing. And that's it from me. So thank you all very much for listening. It's been a pleasure.